Hello students, Jinali Shah welcomes you all on behalf of Saraswat International Academy. Students, the last part of chapter number 8, that is human health and disease, was remaining. So let us discuss regarding the last part of the chapter human health and diseases. In the previous videos of this particular chapter, we have studied regarding immunity, we have studied regarding the two dreadful diseases like cancer, AIDS. We have also studied regarding some communicable diseases caused by various microbes. So now students, in this particular video we will be studying regarding drugs and alcohol. So how drugs and alcohol affects human beings. In this particular video we will be studying it. So let us begin with the part 5 of human health and diseases. Now students, so first thing we will be studying is drugs and alcohol abuse. So surveys and statistics, they show that the use of drugs and alcohol has been on the rise, especially amongst the youth. So the statistical data shows that the use of the drug and alcohol have increased within the youth. This is really a cause of concern as it could result in many harmful effects. Now these drugs when used in excessive amount may cause the harmful effects. Proper education and guidance would enable the youth to safeguard themselves against these dangerous behavior patterns and follow the healthy lifestyle. So now students, the youth should be provided proper education and they should be provided proper guidance so that they could protect themselves from the dangerous patterns or dangerous effects caused due to the use of the drugs and alcohol. The drugs which are commonly used, very important students, the names of these drugs are opioids, cannabinoids and coca alkaloids. These are the widely used drugs amongst the youth. Majority of them are produced from the flowering plant. So where are these drugs obtained from? So these are obtained from the flowering plants. Some of them are obtained from fungi. Most of them are obtained from flowering plants and few of them are obtained from fungi. Now let us first of all study regarding the opioids. So opioids are the drugs which binds to the specific opioid receptors which are present in our central nervous system and gastrointestinal tract. So कोई भी drug के लिए there will be the presence of the receptors. Drugs needs to bind to these receptors to show their effect. So there are opioid receptors which are present in the central nervous system as well as gastrointestinal tract, that is the alimentary canal. So the opioid binds with these receptors. Heroin, commonly called as smack, is chemically diacetyl morphine, which is a white colorless bitter crystalline compound. So heroin, which we commonly called as smack, is a diacetyl morphine and it is white colorless bitter crystalline compound. This particular drug is obtained by acetylation. Acetylation reaction is the esterification reaction with the acetic acid. So this drug is obtained by the acetylation of morphine. Morphine reacts with acetic acid and this drug is obtained from the latex of the poppy plant that is called as Papaver somniferum. Very important. Which drug is obtained from which plant, that is very important student. So morphine is a drug which is obtained from the latex of the poppy plant whose scientific name is Papaver somniferum. Generally taken by snorting. Snorting, it means inhale through nose, and injection. Heroin is a depressant and slows down body function. Now what effects does heroin do? So basically, first of all, it is taken through nose. It is inhaled through nose as well as it may be also taken through injections. Now, how it affects? It is an depressant and body functions will be slowed down due to the use of the heroin. Okay. So, this is the chemical structure of morphine and this is the plant called as opium poppy from which this heroin is obtained. Students, these diagrams and the chemical structures again are very important for your boards as well as for your NEET. Now, next group of drug is the cannabinoids. These cannabinoids are the group of the chemicals which interact with the cannabinoid receptors present principally in the brain. Now, see, as I told you, each and every drug will have the receptors and the drug needs to bind these receptors. These receptors for every drug are present at different locations in our body. जैसे for the opioids, we have studied that their receptors are present in GI tract and central nervous system. Same way, the cannabinoids receptors are present in the brain. Natural cannabinoids are obtained from inflorescence of a plant called as the cannabis sativa. Very important. Cannabinoids are obtained from the inflorescence. Inflorescence is the axis on which the flowers are born. So, arrangement of the flowers on the axis, that is inflorescence. So, which inflorescence? Inflorescence of the cannabis sativa. The flower tops, leaves and resin of cannabis plant are used in combinations, various combinations to produce marijuana, hashish, charas and ganja. So, which drugs are obtained from cannabinoids? Basically marijuana, hashish, charas. What are they obtained? These are obtained from the flower tops, leaves and resins of which plant? Of the cannabis sativa. Generally taken by inhalation and oral ingestion, these are known to show their effects on cardiovascular system of body. Now see, we have studied opioids, right? Opioids are taken by injection and snorting, that is inhalation, and it was acting as what? It was acting as depressant. Same way, cannabinoids are also taken through inhalation as well as through oral ingestion, that is directly they are ingested. Now, where do they show the effect? They show the effect on the cardiovascular system of our body. So, this is the structure of the cannabinoid and these are the leaves of the cannabis sativa. Very important for your boards and needs. Now, next drug is cocaine. So, coca alkaloid or cocaine is obtained from the coca plant called as erythroxylum coca, which is native to South America. So, cocaine is also called as coca alkaloid, and from where it is obtained? It is obtained from a plant called as the erythroxylum. What is the name of the plant? The name of the plant is erythroxylum coca. Now, this cocaine, it interferes with the transport of neurotransmitter dopamine. Now, we have neurotransmitters, like neurotransmitters are the chemical which help to transmit the message between the two neurons or between the neuron and the neuromuscular junction at any junctions. Now, one of the important neurotransmitter of the body is dopamine, and this cocaine, it interferes with the transport of what? Of the dopamine. Cocaine, commonly called as coke or crack, is usually snorted. Snorted, that is, it is usually inhaled through nose. It has a potent stimulating action on central nervous system, producing the sense of euphoria and increased energy. Now, what effect does it shows? This effect, जब ये कोकेन लेते हैं तो normally वो central nervous system को affect करता है, and we feel that after taking this particular drug we are highly energetic. We feel that there is increased amount of energy in our body as well as we feel happy. Okay. Now, excessive dosage of cocaine causes hallucinations. Okay. अगर cocaine is inhaled or if it is taken in excessive amount, it may cause hallucinations. Now, there are other drugs too which show the hallucinogenic properties, and those are atropa, belladonna and the datura. Very important, students, the drugs with the hallucinogenic effect. What is hallucination? भ्रम जिसको हम बोलते हैं, जो होता नहीं है बट अपने को होता है कि like it is feeling like that. So, hallucinogenic drugs are cocaine. Apart from cocaine, there are atropa, belladonna and datura plants. उसमें से जो drugs निकलते हैं, they also show the hallucinogenic effects. These days, cannabinoids are being abused by some sports person too to feel the great energy. So this is the flowering branch of datura. Now there are few other drugs which shows different kinds of effects. So drugs like barbiturates, amphetamines, benzodiazepines and other similar drugs that are normally used as medicines to help the patients to cope up with the illness like depression and insomnia. Insomnia is a sleep disorder. They are often being abused. Now there are drugs जैसे बार्बिचुरेट्स है, एम्फिटेमाइंस है, बेंजोडाइजेपिन्स है, कि ये सब ड्रग्स बेसिकली दे आर यूज टू ट्रीट सर्टन डिसऑर्डर्स. सो जैसे कि दे आर यूज्ड एज मेडिसिन्स टू क्योर mental illness like depressions, insomnia, but ye drugs are abused. They are not used as medications, but these are abused by certain persons. Morphine is a very effective sedative, that is sleep inducing chemical and painkiller, and it is very useful in the patients who have undergone surgery. Now morphine is also used as medicine. कौन सी medicine? It is a sedative, like it helps to a person to sleep, and it also works as the painkiller, and it is also used in the treatment of the surgery. But these particular plants, these particular drugs are now being abused by the youths. Several plants, fruits and seeds having those hallucinogenic properties have been used for hundreds of years in folk medicine, religious ceremonies and rituals all over the globe. When these are taken for a purpose other than medicinal use or in amounts or frequency that impairs one physical, physiological or psychological function, it constitutes drug abuse. कब हम बोल सकते हैं कि ये पर्टिकुलर ड्रग एक्सेस यूज में हो रहा है या when what is drug abuse? ये सब जो drugs है we have seen that they are used for the medicinal purposes. Morphine है, barbiturates है, amphetamines है, all these drugs they are used for what? They are used for the medicinal purpose. What is their use? They are used for the medicinal purpose. But when these drugs are used for the purpose other than medicinal, यानी medicinal purpose के अलावा जब ये drugs use करते हैं and that too in the amounts, excessive amounts, ऐसे amount में जो person के physical, mental and physiological function को damage करता है, then we say that it is a drug abuse. Now smoking. Smoking also paves the way to hard drugs. Tobacco has been used by human beings for more than 400 years. It is smoked, chewed or also used as a snuff. Now smoking is nothing but it is also one of the way to use the hard drugs. Now this smoking is basically tobacco. So tobacco is used by human beings. Now this tobacco is taken in various forms. Either it may be smoked, it may be chewed or it may be also snuffed. Snuff is it is inhaled through the nasal cavity. Now, how is tobacco harmful? Tobacco contains large number of chemical substances including nicotine, which is an alkaloid. So tobacco contains various chemical compounds and one of the most important chemical compound present in tobacco is nicotine. Now what nicotine does? Nicotine stimulates the adrenal gland to release adrenaline and noradrenaline into blood circulation. both of which raise the blood pressure and increase the heart rate. Now क्या करता है nicotine? It acts on the adrenal gland. Now as the adrenal glands gets activated, it secretes adrenaline and noradrenaline, and we know the function of both these hormones. They increase the blood pressure as well as they increase the heart rate. Smoking is also associated with increased cancers of lung, urinary bladder and throat, bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. So smoking, जो टोबैको का एक निकोटिन वाला इफेक्ट तो देखा ही, बट जो स्मोकिंग करते हैं, द पर्सन्स हु टेक दिस टोबैको थ्रू द वे ऑफ स्मोकिंग, then वो persons में there are increased chances of lung cancer, cancers of urinary bladder and throat. Even they may suffer from bronchitis, emphysema, coronary heart disease as well as the gastric ulcers. Now, how tobacco chewing is harmful? Tobacco chewing is associated with the risk of cancer of oral cavity. So, when tobacco is chewed, it causes the cancer of the mouth, that is oral cavity cancer. Now स्मोकिंग के एक इफ़ेक्ट तो हमने देख लिया कि ये सब कैंसर्स करता है, ब्रोंकाइटिस करता है, एक्सेट्रा. बट देर इज़ वन इम्पॉर्टेंट इफेक्ट ऑफ स्मोकिंग जिसमें टोबैको स्मोक में निकोटिन. So smoking increases the carbon monoxide content in the blood and reduces the concentration of hemo-bound oxygen. Now we know that oxygen binds with the hemoglobin, but through the smoking what will happen? Nicotine वो carbon monoxide content increase करता है, and now there occurs a competition between carbon monoxide and oxygen के कौन हीमोग्लोबिन के साथ बाइंड करेगा. सो देयर अकर्स द कंपटीशन बिटवीन ऑक्सीजन एंड कार्बन मोनोऑक्साइड टू बाइंड विद द हीमोग्लोबिन, and as a result what will happen? The amount of the heme bound oxygen reduces. Now so some hemoglobin binds with carbon monoxide, so amount of the oxygen that binds to the hemoglobin automatically gets reduced. Now oxygen hemoglobin से bind नहीं होगा तो body में we will feel the deficiency of oxygen. So this causes the deficiency of oxygen in the body. When one buys packets of cigarettes, one cannot miss the statutory warning that is present on the packaging which warns against smoking and says how it is injurious to health. हम सिगरेट का पैकिंग बाय करते हैं बट उस पर ऑलरेडी लिखा होता है कि इट इज़ इंजोरियस टू हेल्थ. स्टिल वी डू नॉट पे अटेंशन टू दैट नोटिस एंड वी यूज इट. Yet smoking is prevalent in society both among youth as well as the old. Knowing the dangers of smoking and chewing tobacco and its addictive nature, the youth and old need to avoid these habits. Any addict requires counseling and medical help to get rid of the habit. Now, adolescence and drug or alcohol abuse. How the adolescents are mainly using this drug and alcohol and how it is affecting their functioning. So first of all, what is adolescence? Adolescence means both a period and process during which a child becomes mature in terms of his or her attitudes and beliefs for effective participation in society. So it is a period, एक stage भी है और एक process भी है कि जहाँ पे like particularly वो child भी नहीं है, वो adult भी नहीं है. चाइल्डहुड और एडल्टहुड के बीच में का जो पीरियड है दैट पीरियड इज कॉल्ड एज एडल्टहुड. सो बेसिकली वो चाइल्ड भी नहीं है और वो बेसिकली मैच्योर हो रहा है. सो इट पर्सन बिकम्स मैच्योर इन टर्म्स ऑफ हिज एटीट्यूड्स एंड बिलीव्स दैट ही इज नाउ द पार्ट ऑफ द सोसाइटी. The period between 12 to 18 years of age may be thought as the adolescence period. Very important. Adolescence begins with period of rapid physical and sexual development called puberty to maturity at the age of 12 to 18 years. So basically during adolescence there will be the rapid physical and sexual development in an organism, that is जिसको हम puberty बोलते हैं, जहाँ पे फिजिकली यानी ग्रोथ प्रोसेस फास्ट होता है, अपने बॉडी के जो सेक्सुअल सिस्टम है या रिप्रोडक्टिव सिस्टम है, इट बिकम्स फंक्शनल, इट बिकम्स to grow fast and it begins to show the effects. In other words, it is a bridge linking the childhood and adulthood. Adolescence is accompanied by several biological and behavioral changes. So there are various changes seen in the person during the adolescence period. Adolescence thus is a very vulnerable phase of mental and psychological development of an individual. Curiosity, need of adventure, excitement, experimentation constitute the common causes which motivate the youngsters towards drugs and alcohol use. Now ये period में like जो persons होते हैं वो they are very curious, they need to do adventure, they need to do certain excitement, and all these results और ऑल दिस अफेक्ट्स और ये सब मोटिवेट करते हैं यंगस्टर्स को कि ड्रग्स और अल्कोहल को यूज़ करें. दे ट्राई कि चलो देखते हैं ना इससे क्या इफेक्ट होती है, एक एडवेंचर होता है कि लेट अस ट्राई इट. ओके, अ चाइल्ड्स नेचुरल क्यूरियोसिटी मोटिवेट्स हिम और हर टू एक्सपेरिमेंट. This is complicated further by the effects that might be perceived as the benefits of alcohol or drug use. Now, एक्सपेरिमेंट कर लेते, चलो एक बार यूज़ कर लिया, एक्सपेरिमेंट कर लिया, बट जब वो एक्सपेरिमेंट करते हैं और ये जब ड्रग्स यूज़ करते हैं, ये टाइम पे उनको लगता है कि येस इट इज़ बेनिफिटेड, इट गिव्स द फीलिंग ऑफ वेलबींग. ड्रग्स या अल्कोहल के यूज़ के बाद दे गिव द इफेक्ट ऑफ वेलबींग. सो what will happen? The first use of drug or alcohol may be out of curiosity or experimentation. पहली बार जब ड्रग या अल्कोहल यूज़ करते हैं तो that person is curious, चलो ओके, but later child starts using this to escape the facing problems. Of late, stress from pressures to excel in academics or examination has played a significant role in persuading the youngsters to try alcohol and drugs. स्कूल से, घर से सबका प्रेशर रहता है कि यू शुड एक्सेल, यू शुड स्कोर गुड मार्क्स इन एग्जामिनेशन. ये सब स्ट्रेस की वजह से adolescent child or adolescent person may get engaged in using the drugs or alcohol. The perception amongst the youth that it is cool or progressive to smoke, use of drug or alcohol is also a major cause of youth to start these habits. Like youth में एक perception है, उनकी they feel कि cool, जो persons drug लेते हैं, जो alcohol है use करना, that is cool, अच्छा है. So that motivates the youth to use the alcohol or drugs. Television, movies, newspaper, internets also help to promote these perceptions. Other factors that have been associated with drug and alcohol abuse among the adolescent are unstable or unsupportive family structures and peer group pressures. तो दूसरे जो factors, पहला एक फैक्टर है कि क्यों पर्सन इज गोइंग टूवर्ड्स ड्रग्स एंड अल्कोहल. फर्स्ट इज कूल है. सेकंड हमने क्या देखा, टेलीविज़न, इंटरनेट, मूवीज़, न्यूज़पेपर्स, दे ऑल्सो प्रमोट, और वो सब देख देख कर, उसमें जो मूवीज़ है ये सब देख देख कर दे गेट encouraged to use that particular drug. And finally there are some other factors like family stable नहीं है या family unsupportive है. Say for example a person is not excelling in academics, so घर से वो person को डांट मिलेगी या ऐसा कुछ होगा. So ये सब unsupportive family है. and group pressure कि चलो अपना एक friends का group है, एक person स्मोकिंग कर रहा है तो ही बेसिकली एंकरेज दूसरे पर्सन को कि तुम भी लो. सो वो एज ग्रुप का जो प्रेशर होता है कि नहीं होना ही चाहिए, दैट एंकरेजेस द पर्सन टू यूज द ड्रग्स एंड एल्कोहल. नाउ एडिक्शन एंड डिपेंडेंस. Because of the perceived benefits, drugs are frequently used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drug. एक बार ले लिया कोई प्रॉब्लम नहीं है, बट ड्रग एंड अल्कोहल का एक कॉमन इफेक्ट है कि एक बार आपने लिया तो पर्सन मे बिकम एडिक्टेड. दैट इज इनहेरेंट एडिक्टिव नेचर. ड्रग एंड अल्कोहल का नेचर कैसा है, एक बार यूज करें अच्छा लगता है तो ऑटोमेटिकली द पर्सन विल यूज सेकंड टाइम यूज किया अच्छा लगा, सो थर्ड टाइम, एंड इन दिस वे इट पेव्स द पाथ फॉर द एडिक्शन. Addiction is a psychological attachment to certain effects such as euphoria. Euphoria is a feeling or state of intense excitement and happiness. बहुत बहुत आप लोग को अच्छा लगता है. And temporarily feeling of the well-being associated with drugs and alcohol. So what is addiction? Addiction एक psychological effect है कि जिसमें person को euphoria लगता है. Euphoria means he is extremely happy and वो टेम्पररीली उसको लगता है कि इट इज़ वेरी 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 गुड. ओके, एंड ये जो इफ़ेक्ट होती है वो किसकी वजह से होती है, ड्रग या अल्कोहल की वजह से. दिस ड्राइव पीपल टू टेक देम इवन व्हेन दीज आर नॉट नीडेड और इवन व्हेन देयर यूज बिकम सेल्फ डिस्ट्रक्टिव. With the repeated use of drugs, the tolerance level of the receptors present in our body increases. अभी अब मैंने बोला कि हर ड्रग के लिए रिसेप्टर्स होते हैं. नाउ जब ये ड्रग यूज़ हो रहे हैं, एडिक्टेड हो रहे हैं, रिपीटेडली यूज़ हो रहे हैं, तो ये रिसेप्टर्स का टॉलरेंस लेवल भी क्या हो जाता है, इंक्रीज. एंड बॉडी नीड्स दिस पर्टिकुलर थिंग इन द एक्सेस अमाउंट. कंसिक्वेंटली द रिसेप्टर्स रेस्पॉन्ड only to the higher doses of drugs or alcohol, leading to the greater intake and addiction. However, it should be clearly borne in mind that use of these drugs even once can be a forerunner to addiction. अपने माइंड में अपने को बहुत क्लियर होना चाहिए कि एक बार भी ड्रग यूज़ किया तो there are chances कि we may get addicted to drugs or alcohol. Thus, the addictive potential of the drugs and alcohol pull the user into the vicious circle, leading to the regular use, that is abuse, from which he or she may not be able to cut out. In the absence of any guidance or counseling, the person gets addicted and becomes dependent for their use. Physical dependence is a state in which the user's body requires the continuous presence of the drug. So what is dependence? Dependence यानी कोई person को drugs use कर रहा है. Now that person requires that particular drug continuously. That person have become dependent for his lifestyle, for his livelihood on that particular drug. If the intake of drug or alcohol is abruptly stopped, he or she may develop the withdrawal symptoms. Now जो person dependence है, that is that if a person is dependent on the drug, यानी उसको continuously वो drug का presence होना चाहिए, लेना पड़ेगा, and आप वो person से drug या alcohol लेने को stop करोगे, that person will get affected from withdrawal symptoms. So first of all, what is dependence? Dependence is the tendency of the body to manifest, that is to show the one's act or appearance or demonstrate a characteristic and unpleasant withdrawal syndrome if regular dose of the drug or alcohol is abruptly discontinued. So dependence is the tendency of the body which shows the unpleasant withdrawal syndrome if the drugs or alcohol are being stopped to give to that particular person. This is characterized by anxiety, shakiness, nausea, sweating, which may be relieved when the use is resumed again. Now, what are the symptoms? So, symptoms of withdrawal symptoms are anxiety, shakiness, nausea, sweating. Now, ये सब symptoms कब relieve हो गए? अभी पर्सन इज़ डिपेंडेंट ऑन ड्रग, हमने ड्रग देना बंद कर दिया तो ये सब विड्रॉवल सिम्टम्स दिखे. नाउ अगेन इफ यू गिव दैट पर्सन दैट पर्टिकुलर ड्रग, द पर्सन मे बी रिलीव्ड फ्रॉम दिस सिम्टम्स. In some cases, the withdrawal symptoms can be severe and even life-threatening and person may need the medical supervision. Dependence leads the patient to ignore all the social norms in order to get sufficient funds to satiate, that is, satisfy the desire for his or her needs. This may result in many social adjustment problems. अभी कोई भी person dependent हो गया है drugs के लिए, so उसकी family वो कुछ भी कर सकता है, fund को basically drug महंगे आते हैं, तो that person does anything to get the money to buy that particular drug, जिसकी वजह से फैमिली में सोशल एडजस्टमेंट का प्रॉब्लम्स भी हो सकता है. Now, what are the effects of drug and alcohol abuse? The immediate adverse effects of drug and alcohol abuse are manifested in the form of recklessness behavior, vandalism, that is private या public property को damage करना, and violence. Excessive doses of drugs may lead to coma and death due to the respiratory failure, heart failure, or cerebral hemorrhage. A combination of drug or their intake along with the alcohol generally results in overdosing and even death. Combination of drug यानी एक साथ दो ड्रग लेना, तीन ड्रग लेना, या ड्रग और अल्कोहल साथ में लेना, ये तो बहुत डेंजरस है. इन इट में ऑल्सो कॉज द डेथ ऑफ एन इंडिविजुअल. The most common warning signs of drug and alcohol abuse among the youth include the drop in academic performance, unexplained absence from the school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationships with families and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuations in weight, appetite, etc. So, which are the warning signs among the, अपने को कैसे मालूम पड़ेगा कि that particular youth have been using the drugs or alcohol? So, these are some of the signs which shows that the person may be taking the drug or alcohol. There may be even some far-reaching implications of drug or alcohol abuse. If an abuser is unable to get the money to buy or drugs or alcohol, he or she may turn to stealing. अभी जो ड्रग एब्यूज़र है, चलो फैमिली ने पैसे देना बंद कर दिया, अभी उसको वो पर्टिकुलर ड्रग या अल्कोहल पे दैट पर्सन हैव बिकम डिपेंडेंट, सो वो क्या करेगा, वो चोरी करेगा. ओके, द एडवर्स इफेक्ट्स आर नॉट रेस्ट्रिक्टेड टू अ पर्सन हु इज यूजिंग द ड्रग्स और अल्कोहल. एट टाइम्स अ ड्रग और अल्कोहल अडिक्ट बिकम्स द कॉज ऑफ मेंटल एंड फाइनेंशियल डिस्ट्रेस to his or her entire family and friends. Those who take the drugs intravenously, that is direct injection into the vein using syringe and needle, and वो syringe and needle one time use की नहीं गई होगी and वो HIV infected person की होगी, so that particular person who is taking the drug through the injection of the HIV infected person may also get affected, are more likely to acquire serious infections like AIDS and hepatitis B. The viruses which are responsible for these diseases are transferred from one person to other by sharing the infected needles and syringes. Both AIDS and hepatitis B are chronic infections and ultimately fatal. Both can be transmitted through sexual contact or infected blood. The use of the alcohol during the adolescence may also have long-term effects. It may lead to the heavy drinking in adulthood. The chronic use of drugs and alcohol damages the nervous system, liver, that is liver cirrhosis होता है. Liver cirrhosis is a chronic disorder of liver which is marked by the degeneration of the cells, inflammation and thickening of the fibrous tissue. Basically, it is a chronic liver damage which causes the liver to scar and liver failure. The use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. Another misuse of the drug is that what certain sports person do to enhance their performance. Now, drugs को sports person भी use करते हैं उनके performance को increase करने के लिए. But when they are used by sports person, it shows various effects. See, the misuse of narcotic analgesics, that is painkiller, the anabolic steroid, which is a synthetic steroid hormone which resembles the testosterone in promoting the growth of the muscles. Analgesics are painkiller. Anabolic steroids are the steroid like medicines जो टेस्टोस्टेरोन के इफेक्ट जैसे मसल्स के ग्रोथ को हेल्पफुल करते हैं. Diuretics which increases the flow of urine and certain hormones in the sports to increase the muscle strength and bulk and promote aggressiveness and as a result increase athlete performance. ये सब जो ड्रग्स है, एनाल्जेसिक्स है, एनाबोलिक स्टेरॉइड्स है, डायूरेटिक्स है, दूसरे कोई हार्मोन्स है, ये स्पोर्ट्स पर्सन क्यों यूज़ करते हैं? मसल की स्ट्रेंथ को इंक्रीज़ करने के लिए, उसके ग्रोथ को इंक्रीज़ करने के लिए, अग्रेसिवनेस वो प्रमोट करते हैं, जिसकी वजह से एथलीट का परफॉर्मेंस इंक्रीज़ होगा. बट ये सब ड्रग्स के साइड इफ़ेक्ट्स है. The side effects of the misuse of anabolic steroids in females include masculinization, that is, features like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris, deepening of the voice. Very, very important for your boards. What are the effects of the anabolic steroids on the males, in the females? Now, what are its effects in males? In males, it includes acne, increased aggressiveness, mood swings, depression, reduction in the size of testicle, decreased sperm production, potential for the kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of the prostate gland, etc. This effect may be permanent with prolonged use. In adolescent male or female, the severe facial and body acne and premature closure of the growth centers of the long bone may result in the stunted growth. So, what are the effects of the anabolic steroids in males, in females, and in adolescent male and female? Very, very, very important, students, for your board examination. Now, prevention and control. The old age adage, that is a proverb, prevention is better than cure, holds true here also. It is also true that habits such as smoking, taking drug or alcohol are more likely to be taken up at the young age during the adolescence. Hence, it is best to identify the situation that may push an adolescent towards the use of drug or alcohol and to take the remedial measures well in time. In this regard, the parents and teachers have a special responsibility. Parenting that combines with high nature of nurturance and consistent discipline has been associated with the lower risk of the substance abuse. That is, जहाँ पे पेरेंटिंग लाइक प्रॉपर नर्चरेंस से कंसिस्टेंट डिसिप्लिन के साथ की जाती है, सो इट इज़ फाउंड दैट दोज the children or kids of those particular parents are at the lower risk of the drug or alcohol abuse. Some of the measures mentioned here would be particularly useful for prevention and control of drug abuse amongst the adolescent. So, one of the measure is avoid undue peer pressure. Every child has his or her choice and personality, which should be respected and nurtured. A child should not be pushed unduly to perform beyond his or her threshold, be it studies, sports and other activities. Parents को ये समझना चाहिए, चलो उसके ग्रुप एज में पर्टिकुलर पर्सन बहुत अच्छा स्पोर्ट्स में खेल रहा है, बहुत अच्छा मार्क्स ला रहा है, इट्स ओके, बट दे शुड अंडरस्टैंड कि सबकी जो लिमिट है वो डिफरेंट होती है. एंड जब वो ज़बरदस्ती से सब कुछ करवाते हैं, दैट इट मे लीड टू ड्रग और अल्कोहल एब्यूज़. सो वी शुड respect the choice and personality of our kid. Education and counseling. Educating and counseling him or her to face the problem and stresses and to accept disappointments and failures as the part of life. हमें child को ये educate करना चाहिए कि they should face the problems, they should face the stress and disappointment, और ये जो failures है, they are the part and parcel of life. ये तो होता ही रहेगा. It would also be worthwhile to channelize the child's energy into healthy pursuits like sports, reading, music, yoga, and other extracurricular activities. Seeking help from parents and peers. Help from parents and peers should be sought immediately so that they can guide appropriately. Help may even be sought from close and trusted friends. Besides getting proper advice to sort out their problem, this would help the young to vent their feelings of anxiety and guilt. Looking for danger signs. Alert parents and teachers need to look and identify the dangers discussed above. Even friends, if they find someone using drugs or alcohol, should not hesitate to bring this to the notice of parents and teacher in the best interest of the person concerned. अगर आपको मालूम पड़ता है कि आपका कोई फ्रेंड ड्रग या अल्कोहल कंज्यूम कर रहा है तो बी बोल्ड इनफ to give this message to the parent or either teacher so that अगर कुछ गलत हो रहा है तो they can take the necessary steps. Appropriate measures would then be required to diagnose the malady and underlying causes. This would help in initiating the proper remedial step and the treatment. Seeking professional and medical help. A lot of help is available in the form of qualified psychologists, psychiatrists, and de-addiction and rehabilitation programs to help individuals who have unfortunately got into the quagmire of the drug or alcohol abuse. Now already जो person वो particular situation में पहुँच चुका है तो a lot of help is available from psychologists, psychiatrists and rehabilitation center. With such help, the affected individual with sufficient efforts and willpower can get rid of the problem completely and lead a perfectly normal and a healthy life. So that is the end of the chapter number 8, Human Health and Disease. Thank you, students.